Okay, welcome back, folks. We're going to try to finish up H218, the opioids abatement settlement bill. What? Yeah.
Okay,
Yeah.
I'll change the agenda.
Okay, thanks. Okay, and judicial branch, we did that. Elevate, we did that. Department of Health, intervention, harm reduction. Did we do? I think that's where we left off. Number 14.
Yes.
Is that right? Does everybody concur? Okay. Okay, number 14 is 100,000 to the Department of Health redistribution to, again, this is a youth center. I wish I did know where that was. Can somebody look it up and see?
I'll look
if
it
you
up
find
real quick.
anything?
Friends of Change.
Yeah, Friends of Change Youth Center. It'd be helpful to know where that is, because in the other places we put,
Which county?
Which county? Like
Fellows Falls.
Bellows Falls. Okay.
Oh,
Oh, it says right here on this, Friends of Change Youth Center of Bellows Falls.
But there's also money there.
Huh?
Maybe it's youth services.
It is Bellows Falls. That's what
Okay.
Nolan has on his spreadsheet here.
So do you want to add Bellows Falls?
Yeah, so, yeah. Race on it. Okay, anybody have any comments, questions? Feedback? Seems okay, up, down. It's great if you,
Within the context of our
within the
bigger
context of our
conversation.
bigger
Yeah,
conversation,
yeah,
right.
Definitely.
Okay. All right, then 170,000 for Spectrum Youth and Family Services. And this is again around screening, treatment and case management to youth in Chittenden and Franklin. That's the mission of Spectrum Youth and Family Services. Any ups, downs, middles?
Isn't that run by Mark Redmond?
That
Yes.
is around, that is Mark.
Gets nothing.
Yeah. Could you say that louder into the microphone?
Got an email from him right now.
Oh. Okay,
Absolutely.
everybody, everybody's, can you give me a thumbs up or thumb down? Okay, thank you. Okay, 80,000 to Prevent Child Abuse Vermont. Commissioner had a lot of nice things to say about this. This is really aiming at individuals who have opioid use disorder, who are parents, and helping them to learn how to parent through their disorder and after. Yeah.
I mean, they don't only work with, this was specifically for that specific population, but I can also attest, through various jobs, the work that they do. I mean, it's really, really good and really impactful.
It is. They actually have a lot of data. They have a lot of data. I'm just going to say that, a huge amount of data for every program that they do. They have data and independent research. And okay, so we're on, is that a thumbs up? Okay. All right, next we're on to 850,000 to Dale for hireability. That's the fancy name for Voc Rehab to provide specialized employment services. Now this is, this would be expanding to Rutland and Bennington. They have been doing a pilot project for Burlington and Newport that has reported a lot of success. We have actually a report on our website because they were required to submit a report regarding that. I think that the interesting things here that it's been a very significant learning experience for them to understand that employment services for people with opioid use disorder, very different than employment services for people with other disabilities that they have worked with historically. So this seems to be a very good investment in employment for people.
Right.
Okay, up, down. Okay,
How much do they get through human services, Dale, with all the other?
well, this is specifically for this, Dale gets hundreds of millions of dollars.
I
Yeah.
got it yesterday.
Yeah.
Because
It's mostly in Medicaid.
Yeah.
Except for hireability, which is the Voc Rehab. Their federal funding source is through the Rehabilitation Act. It's not through Medicaid mostly. Okay, and then 550 to Northeast Kingdom Community Action. This is for peer support specialists, okay? This is actually one of the recommendations out of the task force that was working this summer, which is around utilizing peer support for people. This is specifically for people with opioid use disorder, but who are homeless. So this seems like very consistent with the work that we're doing. Thumbs up, thumbs down. Okay.
Yep.
The next is 150,000 to Connecticut Valley Addiction Services, and it's kind of a general opioid use treatment in rural Windsor County. Again, another part of the state, which is a good thing, I think. And just to be clear, we are talking about putting some additional language at the end here to really talk about how the on line 15 of the page that we're on, it talks about grant agreements and outcome measurements. So Katie is inserting language there that talks about those being reported to the committee as well, and that they should use those in making decisions. So things that seem a little bit general right now, I think will be helpful as we go on. And again, this is still new. Okay, so that is Connecticut Valley Addiction Services. Any comments, questions? Thumbs up? Okay. And then the next one, we actually do have some, this is a continuation, 300,000 to Vermonters for Criminal Justice Reform and the Johnson Health Center. You heard the commissioner speak about the partnership. That is a relatively new partnership, but we had an opportunity in this committee to actually visit the Johnson Health Center and learn about their services for people with opioid use disorder. And they are acting as a very good resource for folks who are leaving corrections and have been involved with the correctional system. And, particularly around wound management and other issues related to opioid use disorder. So this is actually continuing a program that began this year, that was funded this year. And even though it was not on the legislature's, we want you to continue this in your appropriations. As the commissioner said, the committee felt strongly enough about this that they wish to continue it. Is that okay for people? Up, down, okay. Next, 30,000 to Treatment Associates of Washington County Mental Health to hire an embedded recovery coach. And I wish I had asked embedded where?
Embedded where? Associates.
Somewhere within their agency.
Well,
Like, is it embedded in the CRT services? Is it embedded in?
Just check.
Hire an embedded.
I think.
So are you gonna Google it, Anne?
Yeah.
Okay, I was about to Google it. I don't have no what to do.
I know, Taylor was our Google
Taylor
queen.
and
She
Noah.
was like, and Noah, right,
Okay.
both of them.
I think they used to be independent. They're not. Yeah, division of Washington County.
It's a division of Washington County.
Yeah, it's a specific treat, so embedded within, in other words, it's sort of like saying embedded in your primary care office. What they mean is embedded in the treatment associates
Oh, at Washington County.
at Washington County.
Okay.
They're a specific, it's mental health, substance use counseling and treatment center.
So it's a specific division within Washington County?
Yes.
Okay.
Treatment associates is, yeah.
Okay. Any questions about that? Except for, I know it's not sufficient to hire a recovery coach.
That's not.
So it must be partial funding,
Yeah.
but yeah, go
I
ahead.
have my question. Is this normal to hire a specialist?
Yes, it is normal to hire a specialist, but you don't usually get it for $30,000. That's,
Maybe it's on top of a job they already have there.
that's what I'm wondering.
Do that at the town.
They could have people
Other-
fulfilling that.
Yeah,
Overlap funding.
yeah, we have our DEI person is our economic person, but it's her additional job, so we pay her.
Mhm.
Yeah.
Yeah. Yeah, go ahead, Aaron.
Not a concern of whatever the endeavor is that they're choosing to do. But I know, a lot of, recovery coaching is mainly run out of the recovery centers. And I know a lot of the, recovery centers do got MOUs in place with other providers in regards to station them and through that care. My concern is hiring a recovery coach, embedding them into the service. Once that funding is no longer available, it's just a little bit of a concern. What they do, but we've seen it's a much more effective practice when the mental health and other substance abuse treatment providers are in a memorandum of understanding with their recovery center and they're collaborating the approach together. I just don't want to see some of this stuff get siloed to where there's sometimes a lack of oversight in regards to the recovery coaching.
Or that we're recreating it in different places where
Right.
it might be,
Duplicated.
yeah,
Kind of reinventing the wheel when the wheel already exists.
yeah.
Um,
So, since we didn't ask that question yesterday, I think we should probably go ahead with this, but then, keep an eye out for
Yeah.
next year. Yeah.
yeah.
Ann's ahead of me already. I see that. Okay, so, okay with this one?
I'm not.
You're down? Okay. Okay. The next is a very specific amount, 20,824 to Umbrella. I had to look that up yesterday. Go ahead, Ann.
So Umbrella is an organization in based in St. Johnsbury, also in Newport, creating a Northeast Kingdom where all people thrive, free from abuse and oppression. They have family-based services at the Family Room and the Kingdom Child Care Connection. So it looks like they're fairly active.
So
The support group. Yeah.
and the part that I like about this, and with Partners in Recovery in Northeastern Vermont, so not recreating, kind of getting exactly what you just talked about, Eric.
Right.
Yeah, I like these project, these that can be co-occurring. I'm liking some of these smaller projects, how they are really kind of looking at these issues from.
And they also have a
lenses.
specific project called the One Prevention Coalition that's specifically targeting substance misuse by cultivating,
Uh-huh.
They have a prevention specialist there.
Great. All right. People good with this? Relatively small amount of money? Okay. Okay, so that brings us to the end, and then we've already reviewed all the rest of this language. That's all just essentially conforming language, updating language from MAT to MOUD. And then also adding the vice chair being that they would elect a vice chair, which I don't know why we didn't think of that to begin with, but okay. And then, so we'll see updated language on this. We just made a couple of minor changes. Just one?
Yeah.
Okay, will you send that off to Katie?
Yeah.
Thanks. And that will be it for today. Unless somebody has a report on anything that is still pending that you haven't gotten to me.
No, I wondered if we were going to talk about the overdue, the Burlington situation.
Oh, yes, we did.
Yeah.
We went over it.
Thank you.
Sorry. Thank you, Zon. Yes, we skipped over the 1.1 million. Okay, so
We're not getting there.
we're not done yet. No, sorry.
Sorry, is that?
Oh, I know you, that is the second thing.
Okay, I gotta find it again.
It's, yeah, it's 2.
There we go.
Okay, so there's, the legislature appropriated 1.1 million last year. It was one of the ones where we said that the funding should continue. No funding has been released. There is no grant agreement yet. I sent you all a copy of the memorandum that came from the city of Burlington, Teresa Vizina, I think is how you pronounce her last name. And so they were making their case for the 1.1 million this year as well as next year. And I know that we had some discussion about whether or not we should appropriate next year, given that they hadn't used any of the money from this year. So I'm opening it up for discussion.
I went.
Eric, what thoughts do you have?
They'll have
Absent the fact, I already know about your thoughts about an OPC. Okay, so,
Unbiased.
yeah.
As I said, whether I agree or disagree is not the premise or anything. Come back to me, please.
I will.
And I would suggest that being consistent with what we've done in other areas, even though there isn't a grant agreement. But there's a letter that says there will be a grant agreement coming, and there's an expectation. I don't know how much strength we could put in that. So I was just going to say that to stay consistent, it's not going to hurt us to leave this same amount in with the expectation that next year they might use it, and then in the next year.
Well, I think that there is a bit of a difference here. The expectation then with that they would be receiving $2.2 million. And because they have not received this year's amount, they don't even have a grant agreement for this year's amount.
They were hoping that we would.
They want
2.2.
They want 2.2.
Yeah,
Oh, I don't agree to that.
okay, go ahead.
I'm not inclined to have the money double up either, but I do have a question. Is this settlement fund something that can come up in BAA? If this project really picks up speed, they get the provider, they identify the location, and by fall, they're ready to move forward to the next step, and they're not feeling they're sufficiently funded, can this be raised in the BAA next year?
Yes, it can be. And I don't feel like we should just be silent on it. So I think that we should have some verbiage, whatever that verbiage might be, depending upon, so it might reference, program under development and, return with an updated report on necessary funds or something like that. But, so other thoughts? Yeah, Anne.
Yeah, I'm thinking along the same line, if in fact they, let's say, what are we, beginning March? Let's say May 1st, they've got the signed contract and they are going to need funding to start expending. Well, that's not the same as it being July 1st. There are a couple of months there. So if they didn't have any opportunity to supplement anything, they would be in effect shortchanged.
Yeah.
And so I think something indicating that we'll maintain our commitment of 1.1 a year, such that if they start early enough that they're running short, I'm not translating it into words.
I do know what you mean. Yeah.
So, in looking at Teresa Bazina's note, she's basically saying the last quarter of the fiscal year is when they're going to be actually implementing some of the work, because they're expecting to have selected the provider March of 2025. So that leaves them 1 quarter to actually probably draw down money.
Right.
So can we just reduce the 1.1
By
that's
one
for this year
quarter.
by 1 quarter to 1 quarter, not by 1 quarter,
To
so
one.
reduce it by 3 quarters.
Right, because
'Cause
they would
they
have
didn't
3 quarters
spend
left
it.
over. Yeah.
And just give for this fiscal year. So instead of giving them 2.2, give them 1.1 plus the quarter of the 1.1.
They would,
Or
we would,
instead of 1.1 and BAA,
Right.
basically.
So that will give them flexibility to, if they do actually meet this timeline, that they're not shortchanged and we won't be like kind of backfilling all this 3 quarters that they didn't have any activity. Does that make sense?
I understand what you're saying. That's on the premise that they would have carry forward essentially of 3 quarters of the 1.1 million that we appropriated this year.
We'd have to authorize carry forward.
Right.
And then,
I guess what I'm thinking, so if we think in terms of months, so they would still need 15 months worth of operations.
Right.
Of which 12 have been funded.
right.
And so we would need 1 quarter in here. Is that what you're saying? I'm just sort of like
Sorry,
working
yeah.
it, I'm working it out in my head.
Yeah.
Yeah. So that's based upon that. I mean, I think that is a logical. I don't think, it didn't seem, I'm looking around the room and hearing people's thoughts that we're not going to double up and give them 2.2 million. I think we probably should allow for the fact that they very well could implement as of the last quarter of the fiscal year. And then they would have another whole year. And we realize that there are also startup. I mean, that was originally intended that there was startup. So so we would then be taking only 1/4 of that 1.1. So whatever that figure is.
And we could specify for the remaining 3 months of the fiscal year.
Well, can we say anything about this year's? We can't affect that.
We have to authorize the carry forward.
Yeah, but
Yeah.
why do we need, if they're gonna be spending money in the last 3 months of this quarter, of this year, the
Mhm.
last quarter, then they've got it. It's there, available for them, right?
But we have to appropriate money for FY 26.
1.1 million.
But then they won't have enough if they start actually working on this at the last quarter of this month.
Will they be working at the same rate they would have been if they've been able to get this done earlier?
Okay, so think about it this way. Think about in terms of months, okay? So think about all of next year's 12 months and starting operations, starting incurring significant expense 3 months into this year. So they have 9 months of this year that they have not used the money. So they're only going to use 1/4's worth of the money. But they will have, and I think we should say something here about the grant agreement extending into fiscal year so that they don't have to have 2 grant agreements. I guess what I'm saying. So we've already funded last year 12 months. So in this budget, we only need to fund 3 months because there's only going to be a total of 15 months of operation.
That's exactly what I'm saying.
Okay,
I'm on the same page.
just, okay.
Yeah, I think I think it's figuring out what
How to
the
say
right
it.
way is
Yeah.
to say it and do it. I think we have the same concept.
Here,
Yeah, I can understand, and I'm just reflecting back to like testimony provided by Dr. Levine and another individual from Burlington. They don't even have I don't believe any of the regulations, protocols, and procedures have even been finished in regards to the Department of Health.
Oh, yeah.
Those are all
Yeah,
done.
those are all
Department of
done.
Health is finished.
Yeah.
Right.
they finished those in September last
All
year.
right, then I'll reflect back to my second point and looking at how long it took Providence to even open up the doors to that. We're talking 4 years. So I'd be more in agreement to removing the amount that's been suggested, keeping that on over to the thing, and then revisiting it the later.
In
time.
budget adjustment.
I don't believe it's appropriate to yank it all. Absolutely.
Yeah.
I don't agree with that concept at all.
So, well, that's what the purpose of budget adjustment is. I'll be honest, I'm not sure that they're going to be, I mean, I think it's a stretch.
That they're gonna be ready to do what they say they're gonna be ready to do.
On April 1, right?
Yeah.
They still need to, I think, in a January news story, Joe McGee of the city was quoted as saying they first need to get the RFP out and a provider picked and then go to site selection. So
They
they don't
haven't
even.
gotten approval of the Burlington City Council yet. That's a required element first.
Right, yeah.
And site selection, they got a lot of hurdles.
There's
And those things come with a cost, and part of this 1.1 million can be used for that. So I don't want to negate that fact. But I think that maybe referencing the intent is to carry forward any unused funds from 1.1 million appropriated in 25 and to review at budget adjustments in 26 if necessary. Are people comfortable with that? So it's not appropriating any additional money this year. It's saying use what you had last year and come back if in fact you actually do get up and running.
So should I,
Like that.
for Katie's purposes, should I just cross out number to A and then.
And then, yeah, and then give her some
language.
suggested language, yeah.
Was Teresa Bassini's salary being allowable cost? And wondering why I haven't drawn that. She started in November.
I am sure that they will, it's a part-time position. I'm sure that when they put a budget together and send a proposal, that they will include her costs, yeah.
Yeah.
The city of Burlington's floating it right now, but, yeah.
So to be clear, to help me get clear, are you proposing, or is it being proposed that we create language that talks about extending or going over with the 1.1 million into the next year plus $275,000? No.
No, what I'm suggesting is that, we have language that authorizes the carry forward of the 1.1 million that was budgeted in 25. And that if necessary, they return for budget adjustment,
For any
additional costs related to operations next
we
year.
can review at that time.
Exactly.
Yeah.
Todd had a question or a thought.
I have thought, I don't agree with any of this.
Yeah, no, I realize
Right.
that.
Right?
I'm with you on that, but we
And then-
passed this. What?
No, but that's my thought, okay?
Right. Oh, okay. you
That's
just
fine,
want-
yeah.
Okay.
Yeah.
We're
Make it clear,
honoring
okay?
the request made by the committee, and we're honoring it.
Well, we're honoring the legislature's
The
decision,
legislation.
Exactly.
past decision,
Exactly.
whether we agree
Agree
with it or
or
not.
not. Right. It's policy now.
So for
Um,
Katie, I'm putting authorize the carry forward of 1.1 million that was appropriated in 25, and if necessary, revisit this in the BAA for 26.
Yeah, and she'll figure out the right language.
Any unspent funds up to 1.1, if by some miracle before the
Yes.
30th, they draw some down.
Well, if it's,
No, it all carries over.
It all
it
carries
all
forward.
carries.
Up to,
I thought we were talking this morning that there are several amounts that they won't carry over, they drop to the bottom
No,
line.
unless we say so. So we're
That's what
saying
we're
these
saying.
things.
Oh, it's
Explicitly saying this does.
yeah,
the 1 point, okay.
Yeah.
Okay, good.
Okay.
we're saying that they have access to the full amount of money that was appropriated in 25. And I just want to be clear, so I'm going to summarize one more time. We are saying that they have access to the full amount of 1.1 million that was appropriated in 25 that can be carried forward into FY 26. And we are not appropriating any additional money in this bill, but we are saying you can come back in budget adjustment if in fact you get up and operating and need
the
the
money.
money
Because you.
because you started
Because
operations.
because you've been operating for more than, because you will have been operating for more than a year at that point.
Exactly.
That's the key, yeah.
Okay, that's that language. Okay, now we're done with this one.
It's this one, yeah.
That's and it's Katie.
That's it.
Until we get the new.
Until we get the new version. Okay, so we are going to vote on this tomorrow. So this will be up on the floor on, it'll be on notice on the Tuesday that we get back. So it will be on the floor. Oh, no, it won't. It'll be sent to appropriations. Sorry, excuse me. It'll be sent to appropriations on Tuesday. They will probably review it either on Tuesday or Wednesday. So it probably will be up on the floor the week we get back. Because this is fairly
Later
straightforward.
in the week.
Yeah. I'm not sure what people, I'm just going to look to you, Eric, if there's something that you want to report.
Absolutely,
Okay. All right.
absolutely.
So.
I'm just gonna need Dan to interpret because I don't pronounce my R, so we might have.
And Katie's working on the items.
Okay. Okay, so Eric will be reporting this out. It's, as I said, pretty, straightforward. So, okay, that language is going in, 8:30 tomorrow, but you can leave now.
And that's the budget, right?
8:30 is for budget tomorrow.
When
Yeah.
do we anticipate voting on this?
On this bill is on the schedule for, maybe 11 a.m. after
All
floor,
right,
after floor.
sounds good.
Okay?
And we're also doing budget final stuff after floor.
After
tomorrow?
floor, we're doing budget after floor, yes. We have mental health coming in. Yes, we do have I'm honestly hoping that let me just put this out there. I need to have from anybody who has anything outstanding, that's language or dollar amounts, I need to have them by the close of business today, which is not that far. It doesn't have to be close of business. I mean, but I'm going to be continuing to work on this and we are going to have a limited amount of time tomorrow. And I would like to get as much of it out to you tonight for you to be able to review if you want to, or early in the morning, if you get up and you're, have insomnia or something, for you to be able to review. So that we have, so that we can move relatively quickly through it, because we've had a lot of discussion about the various items and, I want to be able to, you need to be able to see them all in one document so that you can see the flow. We can make some decisions about if people agree with the priority ranking.